All right, well, welcome everybody. Welcome back, I hope, to some of our video series with the ENCORE Safety Network. And we're excited to bring a topic today that we feel like doesn't get a lot of attention in the safety arena. And we really want to bring the mental and emotional health of our employees, really. And so we've got our familiar faces, Doug Fletcher with Fletcher Safety Consulting, and Andy Bassett with Ellerbrock-Norris. I'm Elliot Bassett with Ellerbrock-Norris. And then we have Robyn Burnett with Best Care, who we're really excited to kind of help us dissect this really important topic. And so, Doug, I know that this topic kind of came up in conversation with you and Robyn. So I might kick it over to you to kind of give that background of what the idea was in bringing this topic to everybody in the network and beyond.
Absolutely. Thanks, Elliot. It's good to be back. Hello, everybody. Hope you're doing well. It is Veterans Day, so just a quick shout out to all of our veterans.
Yes.
Many thanks. We appreciate it. This is a topic that, to be quite honest, a few weeks ago I hadn't even considered, and then just to emphasize how important these networks are, someone else referred Robyn to me. They said, "Hey, you really need to speak with her. She is doing something really important. It certainly affects the workplaces and the companies that you're working with, or potentially does." And so, just like this network, it is intended to be an opportunity to hear about and discuss things that are important to us, and like in this particular circumstance, something that may not have been familiar or even on the forefront. Having said that, to be quite honest, I think this is incredibly important right now for anybody who is involved in workplace safety and health and employee well-being. I think really needs to understand the power and utility of an employee assistance program. We've all heard about them for years. 25 years with the government, we had an EAP. Once a year, someone came to the office and talked about the EAP, and we all just kind of nodded our heads and slept through it and waited to get back to our cubicles, like good government employees. And I just kind of dismissed it. And now that I think about it, we are in such a stressful time right now. There's so much stress and anxiety and even fearfulness in our workplaces that I think we would really be remiss as the guardians, as the caretakers of these employees and of ourselves, if we didn't consider the importance of these mental and emotional health issues. So when I spoke with Robyn, man, the light came on, and I realized this is really something that we need to address. And immediately, we're coming into the holidays, which are always stressful. The election was stressful. COVID is stressful. Just, paying bills is stressful. And so that's why it just seemed like something that we needed to address. And so I am really pleased to introduce Robyn Burnett of Best Care EAP. They are part of the Methodist Health Systems, and I'm just going to let her explain a little bit about what an EAP is and the services they provide. So thank you for joining us, Robyn. We appreciate your being with us today.
Awesome. Thanks, Doug. That was quite the intro.
Yeah, you bet.
You really talked it up there. I think that's really important, and we talk about so often the physical health aspects of our employees, and we're very much remiss in really taking a look at our emotional and mental health and the toll that it's taking on our employees and the real risk that comes with not taking care of that. So, and you hit the nail on the head with, we've heard about EAPs for years. Oftentimes it gets buried. It's definitely considered under a benefits umbrella. Sometimes we don't always like that it is under the benefits, but it is, just because it is an employer paid benefit. But when you think about it, when you start a new company, a new organization, you go through all your onboarding stuff, and your first day on the job, you want to know, where am I supposed to go, how much I'm getting paid, and when does my health insurance kick in? You don't think about those other little things that are perks. You might get a discount at a gym or what have you. EAPs are a part of that group that we forget about, and we don't utilize it until we really need it. And even when I go out and about and I try to explain what I do, I always say, well, when you're starting a new job and they talk about free counseling, oh yeah, I know what that is. So that's what an EAP is, an employee assistance program. They've been around since the 50s, really came off the heels of people coming back from war. And it started really as a drug and alcohol measure. And unfortunately, it still has a little bit of that innuendo around EAP about it being very much a disciplinary thing, and it's related to drug and alcohol. But when we got to the 80s and 90s, you really saw an increase in more companies choosing to offer an enhanced EAP, and they took it much more so on an emotional mental health level. And what we're starting to see now even more, and in light of COVID, talking about it from a preventative approach. So again, if we can keep people from utilizing their health insurance or out-of-pocket costs and get them into this free product that is already an employer-paid product. So that employer has already paid for that employee to use it essentially. And companies pay for, some of them pay for a 3-session model, so their employees can get 3 counseling sessions for them or their dependent family members. Or they can go all the way up to probably about 8 to 10 counseling sessions. When you go beyond that, then you start getting into ACA rules related to health insurance, and we try to stay away from that. We are totally separate. We don't require eligibility. You don't have to give us a census. All you have to do is call us and say, hey, I have 50 employees. They're in the Omaha area or they're in Denver, and we want to get them offered an EAP program. Usually ask a few questions, how robust of a program are you looking for? Because you got to also understand a lot of EAPs are buried in like life insurance plans. And I told Doug, those are garbage. They're total garbage. People, you talk about an already buried benefit, and then you're burying it further into something that people rarely use. So, and they're usually just a call service or answering service of some sort. We're a high touch EAP program. We're an enhanced, or sometimes people call it, I can't remember some of the terms they use. You guys would know, but the terms that they use for this added benefit, even though I would say about 80% of the companies that we partner with already have a free EAP as part of their life insurance, they want something extra for that reason, that high touch. So that in and of itself is what EAPs are all about. How they came to where they're at today. And now we're just seeing a huge increase since COVID of employers recognizing that this is important. So we just got a call today of an employer group of eight employees. Before it used to always be, we're likely too small and you're probably too expensive, neither one of which is true. We have employer groups that are 5 to 10 employees, all the way up to our largest group we partner with is about 12,000. So really, it's a whole range of people that can benefit from having an EAP, and also of any type of employer. So, whether it's manufacturing, a small healthcare clinic, to a small insurance agency, really, EAPs are for anybody. If anybody that has a mental health issue, which I think is any one of us, and yeah. But people also need to recognize that it's not just for the employee, it is for anybody that's considered financially dependent that can use that benefit. So if you have a son or daughter that is going to college in Kansas City, they can tap into that EAP benefit. All they have to do is call and say, hey, my dad works for such and such company. I'd like to use their EAP benefits. That's all we need. Mm-hmm. But we offer a lot of, as hard as it is for emotional and mental health to put some return on investment statistics around that. It's not an exact science. We can show real clear utilization, but what we like to do is we like to give pretty robust reporting, not just on those that utilize the program from within your organization, but also what did that probably save you over that course of time? Mm-hmm. So getting them back to a higher productivity, keeping them out of turnover, the cost with potential risk. So we factor all those things into it. And I can go off on many other tangents of what we bring to the table, but we also do pre and post assessments with anybody that comes in for clinical services that shows real tangible results related to absenteeism, presenteeism, life distress, work distress. So we like to show as much tangible stuff as we can in a world that doesn't usually show very tangible results.
Mm-hmm.
There is that's really a lot there, actually.
That's a mouthful.
It's fantastic, because I could go a lot of different ways with questions, but I think the first one that just comes to my mind, simply because of the audience that I know is primarily going to see this with especially in the ENCORE Safety Network. Walk through maybe your experience or how EAP plays into employee injuries. When we see things happen on the work site, it can be a really emotional event. I mean, take the worst case scenario, a death on a job site, or certainly just a serious injury. I mean, how have you seen maybe usage for the mental state of those that have experienced, one of their coworkers suffering a significant injury or even a death?
Yeah, well, and what I was telling Doug last week or the week before we had the initial conversation is that employers have to keep in mind that their employees are going to process that in one way or the other, and it can come out in many, many different forms, and to not underestimate that something could be deemed as traumatic. We all perceive things differently. And so you and I could be standing next to each other and see the exact same thing. You could walk away from it, be completely resilient, go back to your work that you were doing at your computer and be just as productive as you were before. Me, on the other hand, I might interpret that a little bit differently, and I have to take 2 weeks off because I can't even concentrate, I can't focus. And those are things that lead into those risk issues. If I can't focus on what I'm doing, I'm distracted easily, I'm preoccupied, those are some major risk issues. And one thing I was telling him as well is that an interesting thing that we've seen transpire over the last few years is the increase in requests from employers for, we call it critical incident response, what you're referring to. Sometimes they'll call it critical incident stress debriefing, crisis response. I mean, you can call it all kinds of different things. But we've seen a major increase in this over the last few years, and this can be done in person or virtually for those that have workforces that are all still working remotely. This isn't something that has to be in person, although, I'd argue that it's better that way, but isn't everything. I mean, prior to COVID, everything's better in person, but we're just into this bubble of virtual. So I don't want to diminish that virtually can still be done and can be, as effective as being in person. But, people process things so differently that it's so important for employers to know that, and they're aware of that, and know that maybe 1 out of 10 was likely very, very affected by that incident. And also the uniqueness of requests. So historically, it's always like, if there was a workplace accident, somebody saw somebody fall off a ladder, or there was a death of an employee, those would be the big things, or a robbery. Those would be big things that we would go on site for. Now we're getting requests for really interesting things, which again, I appreciate, because we don't know how somebody might perceive a situation and be traumatized. So for example, we've had requests for anytime there's I'm butchering my words here, but what are those machines, the ATD machines, when they have to use, sometimes they, on somebody's heart?
Defibrillator?
Yeah. They, sometimes they have it written in their policy that anytime that is used, it's a mandatory critical incident response.
Mm-hmm.
So things like that, or the death of an employee's loved one. So a spouse or a dependent family member. Sometimes they'll bring a counselor on site for that as well. So just unique things that maybe 5-10 years ago an employer wouldn't have thought of.
Mm-hmm. That's really interesting to me. I personally, I know how stressful a workplace fatality can be. Having worked for OSHA for 20 years, we investigated a lot of fatalities, and frankly, the investigators themselves feel a lot of that stress. And so, but I did have a client a few years ago, unfortunately, since I've been working as a consultant, a construction company in town here, they had a fatality, an electrocution on one of their work sites. And I can tell you from experience and from working with them after that incident that they were not prepared for that. No one is really prepared for that. But the one thing that their safety manager and I have talked about since that event was they were not prepared for that mental and emotional, the impact that had on their employees and the subcontractors that had been on that site. And so since then, they have aligned themselves. It might even be with you for that matter. I don't want to mention their name necessarily, but that was something that I think that we have contingencies for everything. We need to have contingencies in place for the unthinkable event that someone would be killed on a work site or would have a serious injury on a work site, and how we're going to address that. Otherwise, the impact could be, I've seen businesses shut down because they could not respond to an incident like that. So I just think it's critical.
Yeah, I agree. And, I try not to be too harsh because, again, my clinical background comes out a lot, but I think it's an employer's obligation, a duty that they do have these measures in place. Yeah, you can't prepare your workforce for these incidents, but you can have things in place to help them debrief afterwards. And I think that messaging goes so long and so far when an employer says, I care about you, I'm invested in you, I want your emotional and mental health to be on point. I'm going to bring this counselor on site, whether you talk to them or not, that's your call. But we're going to pay for somebody to be here. Now, I will say a lot of times employers that we partner with pre-bundle in on-site hours, but these can always be offered a la carte, or like I told Doug, you don't even have to partner with Best Care, and we can still provide these services. So I think the messaging in and of itself, even if nobody utilizes it, the messaging says that your employer cares about you. And I'm telling you what, when that messaging gets to heart, they're going to be with that organization that much longer. So when you talk about retention efforts and engagement, I mean, those things go a really long way. And I'm with you, Doug. In my previous worlds, I definitely experienced some traumatic incidences with not only my own staff, but with the clients that we served. And we never did any debriefing. And I look back now and I think what I could have done differently as a manager, or really advocated with those in senior leadership position, that we really needed to have somebody do that.
I agree.
Yeah, I couldn't agree more with that either. And going back to the employer obligation, it's interesting because I do feel like many of the employers, us included, it's something that it's out of sight, out of mind, right? You see an injury, a physical injury, and there's work comp policies that you have to manage through that impact when a physical injury happens. And there's all these different things that make that very top of mind. But mental and emotional health is just not a top of mind. As important as I think that the stigma around it has kind of come down over time, which is, I think, a very positive thing. But I think that's just so important that it kind of just becomes awareness that these types of programs are out there. Frankly, like Andy and I were talking before, Doug said, do you guys know what an EAP program is? Nope, had no idea. And so I think that's part of it is just, which is why this type of format becomes so important, is let's get the message out around these types of programs, around the value that they can bring to employees, and be proactive about it. That's one of the biggest things we preach, is be proactive, not reactive when these things happen, so that you can be prepared for when they do happen.
Absolutely. And, I think the biggest thing that I always want to hit home is, whether you partner with Best Care or not, of course, I ultimately would love to see more people come on board with Best Care, because I believe in what we do and how we service our client companies. But I just want people to know that it's likely that your employer has an EAP. I think it's upwards of 80 to 90% of companies have an EAP. So for people to at least know that there's a resource available to them. I just had this conversation with my sister-in-law a couple weeks ago. She works for an employer that doesn't partner with us. And she's having some struggles with her daughter. She thinks her daughter has some ADHD, my niece, and she's 10. And I said, Julie, you have an EAP. I know for a fact you do. And I said, this would be completely free to you. Really? I didn't know anything about that. I said, okay, well, first of all, what do you think I do? But yeah. That's a side point. Apparently nobody listens to me, but she did actually call her HR department, get something scheduled, and has had an amazing experience. So I think if nothing else, I want to tell people that these resources are likely available to them. If not you, maybe your wife or your husband has it, or, you know, whatever the case may be. There's a lot of resources out there. And if none of those things exist, there are other resources in the community that I can help point people in those directions. I have the social work background as well, so I can help point people in the right direction when it comes to resources.
Fantastic. Awesome. And that's really what this network is about, resources and network and identifying providers and sources. And so I know that I have just Googled Best Care EAP and found your website, and there's lots of information on your website. You're located here in Omaha, is that true?
Yeah, we're hubbed here in Omaha. We're an affiliate of Methodist Health System, but we partner with over 250 organizations locally and nationally. So we are a national provider. We have over 5,000 providers across the country. So like I said, if somebody was located here in Omaha, some of their dependents may not be. So we have to contract with counselors in all those areas to make sure that we're meeting those needs.
And I have one last question. I know that you mentioned you can actually be in a partnership agreement with Best Care, or there are also a la carte options that you could just contact just specifically for certain needs or for certain issues. Training is one of those things. I think I read on your website, actually, I know workplace violence is something that is oftentimes considered within the realm of occupational safety and health. And that's, so there are a number of different training opportunities that people might be able to avail themselves of through Best Care.
Yeah.
Could you mention that just briefly, what kind of things you do that they might be interested in?
Yeah, some common ones that people reach out to us about who may not contract with Best Care are sexual harassment training, bystander communication training. We offer verbal defense, those verbal de-escalation skills, and then workplace mitigating workplace violence. We have a program on that as well. So we have close to 100 training topics. Again, we are very robust. We don't just have the counseling services. We have performance coaching. We have all of our training offerings. We do a lot of leadership and management. We call them boot camps. So all day boot camps, really helping people develop those soft skills who may be new in leadership or maybe need a little bit of a refresher. And then we also have our critical incident response, like we mentioned. So all of those things, any of our services can be offered a la carte, that you don't have to have what we call like a standard EAP contract with us. I will tell you, it saves you significantly. You end up usually paying about double. We call it our non-client rate for those services, but it's great to have in your back pocket if you need it.
Mm-hmm. Fantastic.
That's awesome. I know we're getting close, Elliot, on time here probably for this one. I think for those watching though, there's a lot of stuff. I would love to see us maybe dive into a few more of these in future videos, because I was just taking some notes, and you talk about connecting the mental health protection in EAP and how that can play into keeping it outside of the healthcare, your healthcare spend. There's a major connection there. I'd be really curious about how COVID has played into increase. You mentioned dependence, and that the scenario you mentioned with I think you said niece, and that type of stuff. I think we could really get into some cool things. So I would say, guys, and Robyn, not all guys, I would say I would love to see us dive a little bit deeper. I think this is great. So thank you so much for the time.
Oh yeah, anytime. And any of the things that I mentioned, or I have articles out there too, if something comes to mind. If there's any connections that we can do to really mitigating risk at the workplace and trying to minimize distractions and whatever the case may be. I didn't even get into drug and alcohol. But I think that you all are pretty well versed, but I think also a big one would be psychotropic meds. People being influenced by those. There's a lot of different avenues.
Yeah, definitely.
Sounds like a little series coming.
Yeah.
Yeah.
I think you really will.
You're going to be sorry that you ever entered this network, Robyn, probably. But,
no, not at all.
It's just the way that it goes. But thank you very much. I'll let Elliot wrap up. But me personally, my 2 cents is that this is something that all of my clients are being notified about. We've been talking about it. I think everyone really needs to give some serious consideration to how they are addressing the mental and emotional well-being of their employees, and the fact that it extends into family members and beyond just the employee, I think is also fantastic. So certainly my thanks, and I would encourage everyone that's listening to sit down and really consider how you are treating those issues.
Definitely.
Elliot, I'm going to let you wrap it up, buddy.
Yeah, absolutely. Well, we appreciate, Robyn, your time, as we've mentioned, and we will link or put your contact information on everything so that folks can reach out directly to you. But certainly look for more content like this coming forward, moving forward, because we do feel like this area is very important and it's very broad, and we've talked probably longer than we anticipated because it is such an in-depth topic that we get passionate about. And so with that, we'll wrap it up, and thank you, everybody, and have a great night.
Thank you, Robyn.
Thank you.
Yeah.